Part 2 will focus on what to expect on the day of surgery and what to expect during your hospital stay. Follow the instructions given to you for food and liquid restrictions the morning of surgery. If you do not follow these restrictions, your surgery may be delayed or even canceled. Take medicines as directed by your healthcare provider. If you have questions about which medicines to take the morning of your surgery, contact your healthcare provider before the day of surgery. It is a good idea to look at your hospital map to know where to check in and where to park on the day of surgery. Remember to allow extra time for parking, walking, bad weather, and traffic. It is very important that you check in at your scheduled hospital arrival time. This should be listed on the paperwork you received from your surgeon's office. If you did not receive a scheduled hospital arrival time, please contact your surgeon's office. When you arrive at the hospital, go to the surgery registration area or other area as directed to check in. After checking in, you will be directed to a waiting room and then brought back to the pre-surgery care area. Once in the pre-surgery care area, a nurse will meet with you to complete your care plan. After you are settled, the person with you will be invited to join you. Your healthcare team includes your nurse, surgeon, and anesthesiologist. They will discuss what to expect before and after surgery, your procedure, and the type of anesthesia that will be used during your surgery. This is also a good time to ask any last-minute questions you may have. You will be asked to sign a consent form. While you are in surgery and recovery, your visitors can wait in the surgery waiting room. The amount of time you spend in surgery will depend on the type of surgery you are having. Your surgeon will talk with your visitors when your surgery is over. After surgery, you will be taken to the recovery room or post-anesthesia care unit, also called the PACU. Most patients stay about 1 to 3 hours in the recovery room, where your PACU nurse will monitor you as you wake up from surgery. Your visitors are not allowed in the recovery room. They can wait for you in the surgery waiting room. When you are fully awake and your medical status is stable, you will be taken to the post-surgery care area where nurses specialized in spine care will care for you. A member of the hospital staff will tell your visitors your room number so they can meet you there. This is a good time for visitors to go back to the car, collect your belongings, and bring them to your room. Having no pain while in the hospital is not realistic, but pain can be controlled. Your healthcare team will work closely with you to help manage your pain during your hospital stay and when you return home. Watch Part 3 of the Spine Program Pre-Surgery Education videos for information about how to manage your pain after surgery. It is also important that you review your care map. This will help you understand what to expect during your hospital stay and your goals after surgery. If you did not receive a care map, please contact your surgeon's office to ask for one. You can also ask for one at the hospital. The following information in this video will focus on your care map goals. It is a good idea to follow along with your care map if you have one. Activity after spine surgery is very important for your recovery and to help prevent complications. On the day of your surgery, you will work with your healthcare team to sit at the edge of the bed. If you are able, you may also stand or walk. Your goal is to walk 3 to 5 times each day during your hospital stay. Your healthcare team will help you to walk safely and meet this goal. You will also be asked to do ankle pumps, buttocks and thigh squeezes, as well as other activities if ordered by your surgeon while in the hospital. These exercises, along with walking, help to promote circulation and to build strength after surgery. Please watch Part 4, Activity After Spine Surgery, for more information about your activity restrictions after surgery and your home exercise and walking program. After surgery, your surgeon may order for occupational therapy, OT, and physical therapy, PT, to work with you during your hospital stay. OT and PT help to make sure you are managing your daily activities safely, such as walking, climbing stairs, getting in and out of a car, dressing, and managing your bathroom needs. The next section on your care map focuses on food and liquids after surgery. Many patients may have sips of clear liquids right after surgery. Your nurse will let you know what your surgeon has ordered for you to eat or drink after surgery. What you can eat or drink will be advanced as tolerated. This means that once your stomach and bowels are ready, you will be able to drink more liquids and eventually eat your regular foods. Your nurse will listen to your stomach for noises and ask if you are passing gas to determine when your stomach is ready. Having enough fluids in your body after surgery is very important for your healing. You will have an intravenous line, or IV, to give your body the fluids it needs during and right after surgery. Once you can drink liquids, your IV will be stopped. Your healthcare team will encourage you to drink 6 to 8 glasses of liquid each day. Your care team will also help to make sure your bladder and bowels are working properly after surgery. You may have a bladder catheter placed during surgery to monitor your urinary output. The bladder catheter is usually removed within 1 to 2 days. Removing the bladder catheter as soon as possible will help prevent a urinary tract infection, or UTI. After the bladder catheter is removed, your healthcare team will monitor your ability to urinate by measuring your urine output. You may also have a bladder scan to make sure you have fully emptied your bladder. It is very important to prevent constipation after surgery. Constipation can be caused by pain medicines or decreased activity after surgery. Walking is one of the best ways to prevent constipation. You will begin walking as soon as you are able after surgery and continue to walk 3 to 5 times a day during your recovery. Make sure you drink plenty of liquids and eat high-fiber foods. The next section of your care map focuses on your breathing. You may need to use oxygen for 1 to 2 days after your surgery. You will be taken off the oxygen before you leave the hospital. If you use a CPAP machine, remember to bring it with you to use during your hospital stay. Preventing pneumonia after surgery is very important. You will be asked to walk around and sit in a chair several times a day. This activity will encourage you to take deep breaths. You will also be reminded to do deep breathing exercises. To help with these exercises, your surgeon may order for you to use an incentive spirometer. Your healthcare team will teach you how to use the incentive spirometer if needed. It is important to take care of your incision after surgery. You will have a dressing or bandage covering your incision after surgery. Your dressing may be changed or removed during your hospital stay. Your surgeon may place a drain next to your incision during surgery. A drain helps to draw out extra blood and fluid from the area around your incision. If you have a drain, it is usually removed 1 to 2 days after surgery. Before you leave the hospital, you will be given instructions on caring for your incision. Do not soak your incision in water such as a bathtub, hot tub, pool, or lake. Your healthcare team will also give you instructions on how to shower. Hand washing is very important to help prevent infection. Make sure to wash your hands well with warm water and soap. Ask your family and friends to also wash their hands well before helping you during your recovery. Thank you for watching Part 2, What to Expect the Day of Surgery and During Your Hospital Stay. The comfort and discharge planning sections of your care map will be covered in Part 3 and Part 5 of the Spine Program Pre-Surgery Education videos. For more information about your comfort and pain management after surgery, please watch Part 3.